Hello friends, good evening. I am Dr. Avnish Goel, a senior consultant dermatologist and aesthetic laser surgeon. Having post-MD clinical experience of over 15 years, I am an educator and orator in dermatology, sexually transmitted diseases, lasers and aesthetic procedures. With more than 25 publications, I have vast clinical experience. For the benefit of the learners, I have a Telegram group. The name of the group is Dermatology by Dr. Avnish, and the link to that group is dermatology underscore for underscore NEET PG. So my referral code on Unacademy, it is DOCAVI 5397. On for YouTube it is DR Avnish hyphen YT. So let us start with the few announcements. So Unacademy has introduced an iconic subscription, which is a subscription of Unacademy plus you will get the subscription of Prep Ladder also. So you will get the best of Unacademy in the form of live classes and batch courses, also the live test and quizzes. You will get the best of Prep Ladder in the form of video lectures and question bank and rapid revision courses. So these are the various packages for the iconic subscription. The charges, it depends upon the length of time for which you want to take the subscription. So 1 year subscription is around 49,500 rupees. And to avail the discount, you can use the 10% of discount. You can use the code mentioned here in DRAVNISH hyphen YT. And for plus subscription, it is for 1 year, it is around 24,750. Again, to avail the 10% discount which is included in this amount, you can use the code mentioned here. So also on Unacademy, it's going on a daily T20 series. So for the NEET PG 2022, the series is at 9 p.m. every day, wherein you will be asked 20 MCQs of all the branches. And for the T20 series for NEET PG 2021, it is going on at 8 p.m. Again, you will be asked 20 MCQs of various subjects. So you can log in, you can see you can assess your performance if you log into this series. Then let us start with the topic in proper, the 6 PYQs of INI-CET in dermatology. So the INI-CET, it includes the JIPMER examination, PGI examination and AIMS examination. And in this particular topic, in this particular session, we are going to discuss the PYQs of year 2020 and 2019. So this is your first question. So anybody with the correct answer? So the correct answer for the given question, it is the herpangina. So why herpangina? If you go with these points, the 6-year-old child, the age, then the patient had history of fever, the painful lesions over the palms and soles, and so much so that the oral lesions, they are also painful. The oral pharyngeal deposits, the oropharyngeal lesions, they are also painful. So the painful lesions over the palms and soles and the painful lesions in the oral cavity, so that goes in favor of hand, foot and mouth disease. And when the anterior part of the oral cavity is affected, it is called as oral ananthems. And when the posterior part of the oral cavity is affected, it is called as herpangina. So when the posterior part of the oral cavity is affected in hand, foot and mouth disease, it is called as herpangina. So hand, foot and mouth disease, it is a highly contagious infection mainly caused by Kawasaki A16, but it is also caused by enterovirus type 71. The route of transmission is fecal-oral route, or it could be respiratory secretion. The incubation period is short, it is around 3 to 6 days, and it usually affects children who are less than 10 years of age. So children having less than 10 years of age, they are affected by this fecal-oral route of transmission of Kawasaki A16 and enterovirus A71. So you can get painful lesions over the palms, you can get the painful lesions over the soles, plus you can get the painful lesions in the oral cavity. When the anterior part of the oral cavity is affected, it is called as oral ananthums. When the posterior part of the oral cavity, the hard palate and all uvula is affected, then it is called as herpangina. So lesions can be there over the palms and soles over the oral cavity, and all of them, they are painful in hand, foot and mouth disease. So finally, oral lesions will be painful. They can be over the tongue, palate, buccal mucosa and uvula. Cutaneous lesions over the palms and soles, they will again be painful in hand, foot and mouth disease. There can be various nail changes in the form of Bewes lines or onychometasis, and rather hand, foot and mouth disease is the most common cause for onychometasis. Fever subsides in 1 to 2 days, and cutaneous and mucosal lesions, they go away in 7 to 10 days. So both the oral lesions and the cutaneous lesions, they are painful. Question number 2. Yes, anyone with the correct answer? So the correct answer here, so the correct answer, if you go by the age, 4-year-old child with history of high fever, eruptions on the trunk and proximal extremities with conjunctivitis, erythema of lips and tongue, later on desquamation and cervical adenopathy. The answer will be Kawasaki syndrome. So this is the correct answer for the given question, the Kawasaki syndrome. So that is, if you go by high fever, eruptions on the trunk and proximal extremities, the development of conjunctivitis, erythema of the lips and tongues, desquamation of the perineum and fingertips, and the cervical adenopathy. So cervical lymph node enlargement, it can attain greater than 1.5 centimeter in size. It can be very large in size in Kawasaki syndrome. So Kawasaki syndrome, it is a medium vessel vasculitis. It is also called as the mucocutaneous lymph node syndrome. So you will get the mucous membrane manifestations, you will get the cutaneous manifestations. In addition, you will get the lymph node enlargement. So that is the description for Kawasaki disease. So child may present with fever, lymph nodes can be greater than 1.5 centimeter in size. The rash can be seen over the genitalia. Over there can be red eye, red lips, and the involvement of the palms and soles. So these all can be the manifestation of Kawasaki disease, which is also called as mucocutaneous lymph node syndrome. So within 3 weeks, the skin of hand and feet may peel, coronary arteries may be affected, and it is usually seen in children. So this is the description of Kawasaki syndrome: unexplained fever for more than 5 days with associated lymph node enlargement, with severe mucositis, that is, you can get strawberry tongue. with bilateral conjunctivitis and coronary artery aneurysms, along with the swelling of palms and soles. So all these are features of Kawasaki syndrome or Kawasaki disease. So you can get bilateral conjunctivitis. So this is the conjunctivitis you can see in Kawasaki syndrome. You can get the lymph node enlargement. So there can be lymph node enlargement. Then the swelling of palms and soles, later on it can peel. So palms and soles can be affected. Then you can get the strawberry tongue in the oral cavity. So all these can be the manifestation of Kawasaki syndrome or Kawasaki disease. So the mnemonic for the manifestation of Kawasaki disease is clear. So C may be taken for bilateral conjunctivitis, L for the lymph node enlargement, which is greater than 1.5 centimeter in size, E for exanthems, you can see the lesions over the body surface, A for acral erythema and edema, so acral means palms and soles will be affected, and R may be taken for red pharynx and tongue. So these all can be the manifestation of Kawasaki syndrome or Kawasaki disease. So HSP, henox-colon purpura, it is also called as IgA vasculitis, and you get purpuric lesions along with arthritis and glomerulonephritis. So question number 3. Yes, Jeevan, you are absolutely correct. The topical steroids, yes, silent doctor, you are also correct. The topical steroids, among the given condition, they can only be used for contact dermatitis. So for dermatitis herpetiformis, the drug of choice is dapsone. So there is no use of steroids in dermatitis herpetiformis. Rather, it is treated with dapsone or gluten-free diet. Herpes zoster, it is treated with antivirals, and so is the bullous lesion of herpes zoster. So the herpes simplex, they are also treated with antivirals. So contact dermatitis, they are treated, Rahul, you are also correct, they are treated with the topical steroids. So there is no explanation for the question. This is the correct answer, the choice B. Now you can download the Unacademy app from your Play Store, and you can download it. You can choose your goal as NEET PG and get started. So you can choose either from the Plus subscription or the Iconic subscription. Among the Iconic subscription, you can use the time period for which you want the subscription, maybe around 12 months. And you can, if you punch in the codes like Dr. Avnish-YT, which is mentioned here, you will get additional 10% of discount. So about my upcoming classes in November, so I have completed few special classes and YouTube sessions. So about the classes in November, I am doing only the previous year question of 2020, 2019, 2018 and 2017 of AIMS, JIPMER, PGI, FMGE and NEET PG on various platforms. So this is another information. So if you want to do the PYQs with their suitable explanation, you can join me in various special classes and upcoming YouTube sessions. Now coming to question number 4, which is a PGI question. So you can have multiple correct answers for the given question. So anybody who know the correct answer? So the question has been modified. I know the choices, they are different from what you got in examination, but this is just to make you aware that row of tombstone appearance, though it is characteristic of pemphigus vulgaris and drug-induced pemphigus, it can be seen in all of the above conditions. So I know it has been modified a bit from the what the question has been asked in your examination. So row of tombstone can be seen in all of these conditions. So I'll tell you what is row of tombstone appearance. So the correct answer is all the five choices. So row of tombstone is a histopathological feature and it is demonstrated in a fresh blister in cases of pemphigus vulgaris and drug-induced pemphigus. So classically seen in these two conditions, but Ackerman and Kolik, he classified the tombstoning into two broad groups, the decorated tombstoning, the undecorated tombstoning. So this thing, the description has been taken from Indian Journal of Dermatology, Venereology and Leprology. The article named Appearances in Dermatology. So row of tombstone can be decorated, undecorated. So decorated tombstone you get in the intraepidermal blistering diseases where the level of blister is in the epidermis, and undecorated it is seen in subepidermal blistering diseases where the level of blistering is at the dermoepidermal junction. So decorated tombstone you see wherein the dermal papilla, so this is the dermal papilla, it is covered by these cells of the basal layer. So these cells of the stratum basale, they act as the tombstone. So dermal papilla being covered by a single row of basal keratinocyte and it projects into a intraepidermal vesicle. So the tombstoning, it is made up by the cells of the stratum basale. So you can see them in pemphigus vulgaris, that is characteristic for it, but you can see them in Darier's disease, Hailey-Hailey disease, warted dyskeratoma and solar keratosis. So all the three conditions, they have suprabasal split. So this is about the intraepidermal, within the epidermis blisters. Then you can have undecorated tombstone. So undecorated tombstone, herein you get the blisters at the basement membrane zone, and the tombstone, they are made by the dermal papilla. So these are the projection of the dermis that goes into the subepidermal blisters. So these are dermal papilla that project into the subepidermal blisters, and this is seen in suction blister, porphyria, bullous pemphigoid, herpes gestationis and epidermolysis bullosa. So you can get that row of tombstone is a very characteristic feature of pemphigus vulgaris, but to be more precise, it is seen in the epidermis. So intraepidermal tombstoning is a feature of pemphigus, while there can be a subepidermal tombstoning also. So this was for your information. So if the examiner asks about the subepidermal tombstoning, don't think of the pemphigus group of disorders. Question number 5, again a PGI question. It was asked in June PGI 2020. So Rahul is partially correct by his answer C and D. So the cause of ulcer, Dhanalakshmi, A, C and E, you are also, so you are not correct. So this is present in the neuropathic, this can be a neuropathic ulcers, diabetic ulcers, in syphilis you can see the trophic ulcers, and this is the trophic ulcer. So the ulcers like this, can be neuropathic in origin, can be seen in diabetes, in syphilis, and it could be the trophic ulcers, the ulcers over the pressure points. So this could be the answer for the given question. So the cause of trophic ulcers, the ulcers over the pressure point, they can be neurogenic when there is damage to the nerve supply. They can be vascular with arterial origin. They can be vascular with venous origin. And there can be various systemic causes and malnutrition as the cause for trophic ulcers. So among the neurogenic causes, we have the Hansen's disease as the most common. We can have them in the neurosyphilis, in the patients with syringomyelia, spina bifida, paraplegia, diabetes, and alcoholic polyneuropathy. So in these conditions, the nerves are damaged and the foot is painless, so they can develop ulcers over the pressure points. Then among the vascular causes, mainly the arterial origin, they can have it in the peripheral vascular disease, in arteriosclerosis and microangiopathy in diabetes. Then the venous cause of ulcer is the venous stasis ulcers. And among the systemic causes, they can be due to vitamin B12 deficiency, severe A vitaminosis, and the ulcers over deposits of gout. So these all can be the cause for the painless ulcers at the pressure points. Question number 6, taken from AIMS examination. Yes, 100% correct answer by silent doctor. So you are absolutely correct. Followed by Dhanalakshmi, you are also correct. Jeevan, you are also correct. So patch test reading, it was asked in AIMS. So it is taken after, the first reading is taken after 48 hours and second reading is taken after 96 hours. So the correct answer is the choice B, the 48 hours and 96 hours. So what is a patch test? So patch test is to demonstrate the allergic contact dermatitis. So it is a demonstration of delayed hypersensitivity, the type 4 hypersensitivity. So we have 4 types of patch test. So this is the closed patch test. So herein you take the allergen, you apply it on the patient's back and you close it. So the closed patch test, the patches, they are left over the place for 48 hours. Then they are removed. Then the area is marked with ink and the first reading is taken after 48 hours. Then the second reading is taken after 72 to 96 hours, sometimes 7 days later. So mainly the first reading is taken after 48 hours, second reading after 96 hours, sometimes 7 days later, particularly for the elderly and in neomycin allergy. So you take a second reading after 4 to 7 days in elderly and in neomycin allergy. So this is for the closed patch test. Then you have a semi-open test. So this is the second type of patch test. So semi-open test, the patches, the allergen, they are in the liquid state. They are applied over the back or over the other parts. They are allowed to dry for some time, then they are covered. So this is a semi-open test. Then you have the use test. Mainly it is done for cosmetics. So if you suspect allergy due to cosmetics, so they are applied at some distant site from their usual site of application twice daily for 7 days. Again, in both these conditions, the reading are taken after 48 and 96 hours in both the conditions. And the fourth one is the thin lead rapid use epicutaneous test or true test, wherein it is a pre-prepared strips containing the 36 allergens. So true test is a type of patch test, the thin lead rapid use epicutaneous test. So these are 4 types of patch test, and the reading is taken after 48 hours and 96 hours in all the type of patch test. And this is the positivity of the patch test, which you can see the patient to the substance to which he is or she is allergic, that particular area will become red. So this was all which I had to present in today's class. I urge you to attend free live classes plus course and batch courses. You can use the code drafnish-yt to get 10% off. You can follow us on YouTube, you can follow us on Telegram, and I personally will be very happy to answer your queries if there are any. Then you can like, share, comment and subscribe to this YouTube channel, and don't forget to press the bell icon. And finally, I thank you very much for your patient listening. Thank you.